Section 2. What are the consequences of workplace violence? Consequences for the healthcare employee. Acts of workplace violence against healthcare workers can take a heavy physical and emotional toll. Consequences can be both acute and chronic and range in intensity from minor to serious physical injuries, from temporary to permanent disability, and from psychological trauma to death. Negative outcomes may include low morale and productivity that result from lack of trust in management, loss of team cohesiveness, and a sense that the work environment might be hostile and dangerous. Workplace violence may also result in increased job stress, absenteeism, family turmoil, and employee turnover. In addition, there can be a financial impact due to lost time at work and other costs associated with the trauma. It's important to realize that one does not need to be the direct target of a violent act to be affected by it. Witnesses, bystanders, and co-workers often suffer emotional psychological trauma as well. Psychological consequences. The psychological consequences of workplace violence can be as serious and far-ranging as physical consequences. Nurses say it's sometimes easier to heal from the physical injuries than from the guilt, fear, and anxiety that lingers long after the event. Cases of severe psychological trauma, if left untreated, may lead to substance abuse, retaliatory violence, chronic illness, or even suicide. Survivors and witnesses to workplace violence may feel shocked with a sense of disbelief and fear of future events. Crisis. Crisis is an acute emotional upset manifested by an inability to cope emotionally, cognitively, or behaviorally, or the inability to solve problems as usual. Healthcare employees may find themselves in crisis following workplace violence. Sometimes this is limited to the period of time immediately following the trauma. Sometimes crisis may persist for years. Oftentimes, the perpetrators of the violence are also in crisis. Later in this training, we'll look closer at the stages of crisis and intervention strategies with regard to the perpetrator. Manifestations of crisis. There are 4 types of response to crisis. The first type is biophysical. A biophysical response might include rapid heartbeat and increased blood pressure, hyperventilation, rash or hives, stomach pain, nausea or vomiting, diarrhea, frequent urination, chest pain, shaking, release of stress hormones, or trouble sleeping. The second type of response to crisis is emotional. This response might include fear of injury, loss of life, going crazy, high anxiety, shock, disbelief, guilt, embarrassment, or fight or flight response. The third type of response is cognitive. A cognitive response to crisis might include the following symptoms: the inability to focus or concentrate, or the inability to problem solve. The fourth and final type of response is behavioral. This response might manifest with the following symptoms: cannot perform usual work demands, withdrawal, crying, difficulty sleeping, avoiding social interaction, losing your temper, or impulsivity. Outcomes of crisis. Not every stressful event results in a crisis. Crisis is an acute emotional upset or turning point that represents both danger and opportunity. It signals that one's coping ability is depleted, which can result in desperate or dangerous behavior. Acute, full-blown crisis can be prevented if its early stages are recognized. This applies equally to the healthcare employee who may be dealing with an angry, aggressive patient, and to the patient who may be threatening harm to himself and others. In the aftermath of crisis, there is a danger that a traumatized employee could engage in negative behaviors such as retaliation. If the employee receives support from others, the crisis may provide an opportunity for growth, allowing the employee to move beyond the emotional pain, learn from the experience, and return to his or her normal functional level. Crisis consequences, quality of care. Healthcare employees in crisis might not be able to perform to standards of care, placing patients at risk for adverse outcomes. According to the Joint Commission, intimidating or disruptive behavior among colleagues can cause medical errors and contribute to poor patient satisfaction and preventable adverse outcomes. Crisis consequences, healthcare organizations. Healthcare workplace violence leads to increased absenteeism, increased use of sick leave, lower productivity, low morale, and increased requests for job changes. Violence in the healthcare workplace is a major disruption to job satisfaction and has a negative impact on the work environment and the reputation of the healthcare facility. It can result in added costs, from workers' compensation to patient lawsuits to costs associated with hiring and training replacement employees due to staff turnover. Crisis consequences, healthcare professionals. Results from a survey of registered nurses conducted by the American Nurses Association revealed that health and safety concerns played a major role in nurses' decisions about whether to remain in the profession. Internationally, an estimated 30% of nurses want to leave their positions because of worker-on-worker violence and abuse. Workplace violence in the healthcare setting may lead not only to healthcare professionals leaving the profession, but to negative effects on recruitment into the profession.